we speak about upper third molar. Upper third molar. Upper third molar is difficult for extraction because insufficient visualization of the area and limited access. Other factors reduced aperture of the mouth and close proximity of the impacted tooth to maxillary sinus. Sometimes during the extraction of upper third molar, when use the strong force, the tooth go inside the maxillary sinus, lead to complication of maxillary sinus, and in this condition need surgical removal of wisdom tooth in maxillary sinus. We have classification for maxillary sinus. The classification same of lower wisdom tooth, and classification of upper maxillary third molar same as the mandibular third molar. The classification by Archer classified as first megio-angular. Megio-angular. This one is difficult for extraction. This one opposite to lower wisdom tooth. In lower wisdom tooth, the megio-angular easier one for extraction. But in upper, the megio-angular is difficult for extraction. First. Second, disto-angular. This is disto-angular. The crown inclined to distally. Disto-angular. Disto-angular classification. This one is easier for extraction because this area is maxillary tuberosity, less density, and this one not need for more bone removal during the extraction. Why? This one is easier for extraction. In the upper, disto-angular easier for extraction. But in the lower, disto-angular is more difficult for extraction because this area intraramus need more bone removal. Third one, vertical. This is vertical. Vertical angulation, like this. Other classification, horizontal. Horizontal classification. Another one, bucco-angular. يعني the crown of the impacted tooth faced buccally, faced the buccal bone. Another one, palato-angular. Palato-angular, the crown of upper third molar faced palatally, and root labially, or buccally, عفوا. In the posterior area, you must set buccally, not labially. Other classification, inverted, يعني not classified according to this criteria. Megio-angular, disto-angular, vertical, horizontal, bucco-angular, or palato-angular. This one not like each of them. And this is called inverted. And عكس inverted. The tooth usually present with mesial or distal inclination, like mesial and distal inclination with occlusal surface positioned backary. Occlusal surface position backary. We have other classification of third molar according to the Archer, depend on depth of impaction compared to second molar. And this one same as the Pell and Grigori classification for lower wisdom tooth. In this classification, class A, we have class A. Class A, the occlusal surface of the impacted upper third molar are the same level of the occlusal, the second molar, occlusal surface of the second molar. This one, class A. And in class B, occlusal surface of the upper third molar below the occlusal surface of the second molar and above the cervical line, يعني between the occlusal surface and cervical line. This is class B. And class C, occlusal surface of the upper third molar below the cervical line of the second molar. This is class A, B, and C according to the Archer, classified depending on depth of the impaction compared to adjacent second molar. And we have deep classification like this, yani, near the root of the second molar or below the apex of the second molar like this. This is class A, occlusal surface of the impacted tooth is at approximately at the same level as the occlusal surface of the second molar. Class B, occlusal surface of the impacted tooth is at the middle of the crown of the anterior second molar. Class C, occlusal surface of the impacted tooth is below the cervical line of the adjacent second molar. This is clear or not? Classification.
بس عفوا دكتور ممكن تعيده؟ طبعا متأخر عن الصلاة.
نعم حبيبي. Classification. يعني from angulation or just the second one. حبيبي. Classification. We have angulation, يعني according to the angulation. According to the angulation, first mesioangular. This is mesioangular. The tooth is inclined mesially, like this. This is mesioangular. And the second one, distoangular. The tooth inclined distally. And third one, vertical, like this. Vertical, عمودي. هذا عمودي. و horizontal أفقي, like this. This is horizontal. Other classification, bacoangular, يعني face of the, عفوا, crown of the impacted third molar face to the buccal bone, and the root face it to palatally, like this. This is bacoangular. And this one, palatoangular, and crown of the impacted third molar face it palatally, and root face it buccally. And the last one, inverted, not classified according to this criteria. the first classification. And the second classification, according to the Archer, like the classification of Pell and Grigori for the lower third molar. Class A تحسب هيجي ها occlusal surface of the third molar compared to the occlusal surface of the second molar and cervical line. In the second molar, we consider occlusal surface and cervical line. If the occlusal surface of the upper third molar are the same level of the occlusal surface of the second molar, this is class A. And class B, occlusal surface are below the occlusal surface of the second molar and above the cervical line. This is cervical line, and عنق السن, cervical line. This is class B. And class C, occlusal surface of the third molar below the cervical line. Below the cervical line of the second molar. This is classification of upper third molar. We have two types, angulation and depth. واضح هسه؟
واضح دكتور.
Maxillary third molar sometimes is very deep. Need like this. Need more bone removal during the extraction. And the area, in this area, we have maxillary sinus. This is maxillary sinus. This is right and left. Maxillary sinus. When you try to extraction of deep upper third molar, the tooth go inside the maxillary sinus, make problem and or complication for maxillary sinus. If the tooth is very deep, especially upper third molar, no need for removal. No need for removal. Surgical approach for impacted third molar. We have two types of the flap. Horizontal flap and triangular flap. This one enveloped flap. The type of the flap are for upper third molar, first one, second one, triangular. The incision for creating the flap began at the maxillary tuberosity. This is maxillary tuberosity. Maxillary tuberosity, posterior area of the maxilla. Said maxillary tuberosity. And the incision starts from maxillary tuberosity and extend as far for distal to the second molar, like this. An incision start from the maxillary tuberosity and distal to second molar, vertical incision like this, to vestibule fall of the vestibule, like this. And the flap reflected. Sometimes, if the tooth is deep, we have variation for the triangular flap. Variation for triangular flap. And it extends the incision to distal to the second, the distal to the first molar. This is first molar, this is distal side, and this is medial side. Distal to the first molar, if the tooth is deep. Horizontal or envelope flap, the incision began at the maxillary tuberosity and like envelope, مثل ظرف هيك يسوي. Extend from the, start from the maxillary tuberosity and like this envelope to medial of the first molar. Medial of the first molar. And third molar impacted and pass the second molar to first molar. Clear? واضح هذا؟ Extraction of upper third molar. This is upper third molar. This is OPG, يعني radiograph. This one distoangular. This one is distoangular. And it is mandatory to take radiograph before extraction of any wisdom tooth, lower or upper. This is clinical view. Clinical view. After that, make the incision from the maxillary tuberosity and distal to the second molar, like this incision. Like this incision. After that, the flap reflected by periosteal elevator. Reflection of the flap. This is periosteal elevator. Use it for reflection of the flap. After reflection, we expose the impacted third molar and remove of the impact third using double end elevator. Extraction movement depend largely upon the relation between the tooth and maxillary sinus. And if the tooth near the maxillary sinus, not do more movement, because during the movement, tooth go to maxillary sinus, make problem for you. Must be careful about when you extraction of upper third molar. And do like this. After removal of the upper third molar, the surgical field must be in the flap interrupted, simple interrupted. In the lecture, inshallah, after 2 lectures, we give lecture about the suture and the type of the flap. Lecture about the flap and lecture about the suture materials. This is about the impact third molar. Have any question about the impact third molar? Now I go to canine impaction. Canine impaction يعني ناب, canine ناب. Impact canine يعني سن المطمور. They are localized palatally more than labial. يعني most of the canine impaction position palatally, not labially. The classification of يعني position of the canine palatal localization or palatal localization of the crown and labial localization of the root. يعني palatally position of the crown and root located labially, or opposite, labial localization of the crown and palatal localization of the root, or labial localization or ectopic position. Extraction using labial approaches. يعني the approach of extraction of the canine depend on the crown of the impacted tooth. Where the crown located in this approach, in this area, you do approach. And for example, if the crown located labially, use labial approach. If the extraction from the palatally. If the impacted tooth is, in which condition use labial approach? If the impacted tooth is localized labially and is entirely covered by the bone, the procedure for this removal is as the following. First, trapezoidal incision, يعني incision like معين, يعني 4 أضلاع, and reflection of the mucoperiosteal flap as the following. This is canine impaction, canine, located in, according to this radiograph, located labial. Radiograph show impacted maxillary canine. Right canine is located labially, and while the left canine is located palatally. But this is two-dimensional radiograph. The exact position of the canine impaction must be taken CBCT, يعني أشعة الملونة, for detection the location of the canine. After that, make the incision surgical. Make the incision like this. This is معين, يعني from this area and like this, يعني 4 أضلاع. This is trapezoidal flap. Trapezoidal flap. After that, the crown, remove the bone and expose the crown. Remove the bone and expose the crown. After that, full crown is exposed. Use surgical handpiece. Cut the crown, and you must first cut the crown like this. Use the surgical handpiece for cutting. For what? For cutting the crown. This is after. Remove the crown first. Remove the crown. After tooth sectioning, remove the crown. Like this. Remove the crown by steroid elevator. After the crown removed, then remove the root. Before remove the root, make purchase point. Make the hole. ثقب. السن. Purchase point. This is purchase point. Create on the root for placement of the elevator blade. Make the purchase point from the root to place the elevator like this. Luxation of the root using curved elevator. After remove, this is root. After remove the root of the impacted canine, then remove the follicle. This is soft tissue. Using hemostat and periapical curate to clean the area of the impacted canine. After that, this is clinical picture of the canine impaction. This is cut the crown and root in this area by surgical handpiece. After this is surgical field, you must smooth the area. Sharp, if you have sharp area. By bone file. By bone file, the area is smoothed by bone file. By bone file. After that, the flap return to original position and do suturing. This is simple interrupted suturing. The suture, leave it for 7 days. After 7 days, we can remove the suture material. This is for fully bone, the previous for fully bone covered. Now partially bone covered. يعني intraoral patient, you feel the crown of the impacted tooth like this. The principle, same principle, trapezoidal flap like this, and reflection the flap by periosteal elevator and use the sucker for suctioning the blood. This is after removal of the flap, the tooth exposed, not fully covered by the bone. Not covered by the bone. After that, also remove bone to expose the fully crown of the impacted tooth. You try by, in this condition, no need for sectioning of the tooth because not covered fully by the bone. Try by the straight elevators. Try by the straight elevators. Like this. Remove the tooth and smoothing the edge of the sharp of the bone by bone file. After that, reflection the flap to original position and suture it by the flap. يعني suture it using silk type like this. Like this. This is trapezoidal flap. معين عفوا. And thank you. If you have any question, I am ready.
دكتور
نعم حبيبي.
الروت اوف الامباكتد ثيرد مولر اذا سوى ريزوربشن للروت اوف سكند مولر
نعم.
what will we do؟
إذا سوى resorption for the second molar, the second molar must be do root canal treatment or apicectomy. Root canal treatment. Root canal treatment for the second molar, and the third molar must be extracted.
تمام دكتور شكرا. دكتور
نعم حبيبي.
اذا عندنا permanent الكرنين امباكت
نعم.
زين انا سويت له اكزو بعدين شلون اعوضه؟
ماكو تعويض حبيبي. ليش صار امباكت؟ على مود ماكو سبيس حتى يطلع الكناين.
موجود مكانه خلينا نقول ديسيدواس، اذا اسوي اكزو للديسيدواس واشتغل اورثو حيرجع طبيعي؟
اذا تسوي اذا اكو ديسيدواس نشيل ديسيدواس ونسحب الكناين باي اورثودونتيك تريتمنت.
تمام دكتور.
باي اورثودونتيك تريتمنت. يعني retraction يعني put the bracket on the impacted canine and pull or retract the canine to original position to the dental arch.